So let me give you one quick example. So if a surveyor comes up to you and asks, what do you do if a resident runs away and elopes, and you can't find them? Sometimes you may not know what to say. So you could say, well, I would go to the staff workroom, and inside the staff workroom there's a red binder. You go take the surveyor there, show them the red binder, and that's the emergency binder. Everybody should know where that is, and show them this is the map of what I need to do. So you would open up to that page that's about residents leaving, and you would follow the procedure that's outlined on that page. So I'm going to stop talking about the surveyors and the mock survey. In summary, we need to work together as a team, which is the reason we're having all of this training today, is so that you know what all of our focuses need to be over the next coming months on resident safety, on infection control, on fall reduction, and on safe nursing practices. I want to turn to the second piece I want to talk with everybody about, and that is some of the successes that you all are saying that we're having in the small houses. I think this is important. Each of you sat down with a day shift nurse a few weeks ago and had quite a few different conversations. I wasn't present for any of those. I wanted you all to talk as a team to say, this is how we think we're succeeding. And the day shift nurse wrote notes from all the meetings with the day shift, evening shift, night shift staff. We didn't get to capture all 126 voices, but we got a lot of voices that spoke at those meetings. And I want to just use some of the things that you all have said have been successes in the past 3 months, because we often look and see what we're struggling with, but we don't stop and remember what we succeeded with. So Willis House, the teamwork is great. We're meeting the resident needs to the best of our abilities. Shenandoah, our teamwork is good. We have a small number of falls. Residents are engaging in daily activities with us, and residents are coming out for meals that used to stay in their rooms for every meal, and they're enjoying it. In Willis, residents are engaged in Meherrin, the houses are working together as a team. Meherrin's had a lot of call lights, and one of their successes is they've had a reduction in call light response times. They're also getting less complaints from residents after meals. Their cooking is getting better. In Occoquan, they had a couple of residents that were falling frequently, and they've had a decrease in the last month in that frequency of falls. Another success in Occoquan is the residents are always out interacting together. In Powell, the staff are saying that they have a better balance between resident care and kitchen duties. The nurses and the care partners are working together as a team and are developing good routines for both morning and evening care. And they're also learning about individual residents and how to help them best. In Bluestone, they've had an increased proficiency at prepping food at night and at cooking food during lunch and dinner. They're having more staff and resident interactions, and they're also seeing more and more resident-to-resident interactions. Bluestone, they're also are seeing an increased awareness of how to prevent falls and a greater proficiency in learning how to cook new things. James, they've seen an improved time management and well-established routines, and they also said that they're getting better at cooking. Rappahannock, they know the resident routines much better now. They're working as a team really well. One of the staff members said they've had no fires, no major accidents, and no food poisoning, and that is something that we should all be very pleased about. Also, some of the staff in Rappahannock said one of their successes is that everybody is trying their best, and that is what all we can ask from each one of you is. We have so much training that we've done over the past 4 or 5 months, and all we can ask from each one of you is to continue to try your best each day you come to work. And I want to turn to the last piece of my training for you all today, and that is the goals that you all have set together as houses, as well as some suggestions that we've heard from each of you. So first, the goals. In Willis, what I want to do is I want to remind each house of the goals that you set together, so you can be refreshed this week as you go about your day and interaction with each other to continue to work on these goals. Willis, their goal is to engage residents in activities. Shenandoah's goal is to maintain low falls. Meherrin's goal is to have more house meetings. Powell's goal is to do better rounds and reporting at change of shift. And I watched the change of shift from day shift to evening shift last week, and they are doing much better on that. Bluestone's goal is to do better with supply ordering in the kitchen and in resident rooms for the evening shift. They also have a second goal to ensure that all their staff gets their scheduled breaks. James, their goal is to improve communication between shifts and improve their planning when they get new admissions. James House gets an admission about every 3 to 5 days. They're very busy learning new residents. And Rappahannock, their goal is a simple goal, but I love simple goals. Their goal is to keep the pagers on them at all times. So continue to work together on these goals that you have all have set together, and I know you'll be able to say you'll have more successes as you work on these. The last thing is everybody has talked with me, Charity, Kathy, each other, the nurses, about some suggestions that they have. And even on these papers that the nurses filled out, there was much repetition about 3 major concerns regarding time management. Number 1 is that the staff are having a difficulty taking breaks. Number 2 is that we need help in doing a deep clean of the resident bathrooms. And number 3 is probably the biggest, and we need help cooking in those kitchens because it's so complicated and there's so many interruptions. So let me talk about each one of those 3 things and what Goodwin House Alexandria is doing to support you. I just want to emphasize that we hear you, that the executive leadership team hears you, that the CEO hears you. Kathy Anderson thinks about each of you and the amazing work that you are all doing. So first of all, regarding the difficulty taking breaks, if for some reason you miss your break, please remember to fill out a missed break form, and we are required by state law to pay you. Second, the need for help in cleaning bathrooms. Over the last couple of weeks, the housekeeping director, Dennis Sighthammer, as well as Dave Baker, the administrator of operations, have been working with the housekeeping staff to put together a plan for how to use the 2 housekeepers we have assigned to us in a better way. And starting last week, you're going to see an increase in number of deep cleaning of resident rooms that you will, and also a better use of the evening shift housekeepers' time that come over for a couple of hours each night and do a deep cleaning of 2 kitchens. They're going to be learning and trying to provide us with more support in the resident spaces. So just be on the lookout for that, and we'll have more information for that